This is the VOA Special English Health Report. Depression can cause long periods of sadness and hopelessness, feelings of low self-worth, even physical pain. It is the leading cause of suicide. The World Health Organization says more than 120 million people worldwide suffer from depression. But many people may not know it can start at a young age. In the United States, for example, health officials estimate that about 5% of adolescents are depressed. Researchers in the United States have just reported on a study of more than 300 patients ages 12 to 17. All suffered from major depression disorder, the most common form of the disease. The researchers divided them into 3 groups. One received the antidepressant drug Prozac. Another received cognitive behavioral therapy. The third received both. The study found that the best treatment was a combination of antidepressant and cognitive behavioral therapy, or CBT. This kind of therapy teaches patients to recognize and deal with the thoughts that can result from depression. It centers on current feelings instead of past events. At 12 weeks, the researchers found reduced levels of depression in all 3 groups. But they say the group receiving the combination of treatments had the greatest reduction. This continued through the end of the 9-month study. The researchers say 86% of those who received both treatments had improved. This was compared to 81% each in the 2 other groups. The study did not include an untreated control group, so there is no way to know for sure if it was the treatment that eased the depression. The findings by Duke University researchers appear in the Archives of General Psychiatry. The National Institute of Mental Health paid for the $17 million study. The researchers say the group that received Prozac alone had a higher rate of suicidal thoughts than the other 2 groups. Experts say antidepressant drugs can increase the risk of suicidal thinking and behavior in teenagers. And earlier this year, the government asked drug makers to extend that warning to patients age 18 to 24 during initial treatment. Generally, that means the first 1 to 2 months. And that's the VOA Special English Health Report, written by Katie Weaver. To learn about World Mental Health Day, observed each year on October 10th, go to voaspecialenglish.com. I'm Steve Ember.